Some health professionals have developed models of care that reflect reproductive justice values to address injustices, such as reproductive health disparities. We'll hear about one example, the midwifery model of care.
Yes, I'm a British trained midwife. I was born and raised in the United Kingdom. My parents are from the West Indies. And I came to the United States in 1989. I had already been a midwife for 10 years when I arrived. So I had lots of ideas in my head about midwifery and what midwifery was. And I duly started looking for work as a midwife, only to then learn, oh, it's very different here as far as midwifery. There's a lot of history, and also there's a lot of different ways of practice compared to the rest of the world as far as midwifery care. So for me, I've become this independent midwife who works within a system, but also outside of the system. And I currently run a birth center and a prenatal outreach clinic in Orlando, Florida.
Why should physicians have training in reproductive justice?
I think it's so imperative to encourage in this particular field of work a holistic approach to the care. So yes, we're looking at reproductive organs and taking care of women's organs, but at the same time, there's so much more involved with their care. When we look at this from a reproductive justice lens, we realize that you can't just treat or address or examine the uterus in isolation. What is going on with that woman in her mind? What's going on in her life? What's going on in the periphery? And those things are so clearly important that they make all the difference in not only the treatment and management plan, but in her healing. So we know that there is a huge disparity in outcomes regarding, regardless whether it's race, class, or, socioeconomic levels in terms of women's reproductive health. And when we talk about the reproductive justice aspect of it, when we mitigate for that, women do better, they are healthier. So I think the two things need to go hand in hand if we really have any intention of impacting those outcomes and closing those gaps in terms of health for women in this country.
What about other health professionals, like nurses and midwives?
Well, because we are already operating in a system that doesn't recognize that need, hasn't addressed it, I don't think, really in any comprehensive way. And so, unfortunately, as we have developed the midwifery profession, the nurse practitioner profession, the physician assistant profession even, we haven't really changed anything other than creating career paths inside of the existing system. So I'm not saying that there's anything particularly wrong with the existing system, but the system is set up to support medical practice the way we've been doing it for the last few decades. And so midwifery has tried to sort of infiltrate, if you will, or sort of, not necessarily infiltrate, but has tried to fit in with what's already in existence. And actually, midwifery in its purest form doesn't fit. It's almost outside of the current system. And in that place, it seems to do better. Similarly, nurse practitioners and physician assistants, physician extenders, they also are able to deliver care slightly differently when they have the independence to do so. So I do think it's important that other disciplines also incorporate the values of the reproductive justice aspects of medical care in order to perhaps be able to not only enhance their current standing, but their way of thinking, broaden that way of thinking, and introduce into a very established system new ways of being.